Hello everyone. Today my presentation is on aspergillosis, a fungal disease. So I would like to tell you about its symptoms, its causes, its prevention, its cure in this presentation. Aspergillosis fumigatus is a ubiquitous fungus that can cause a range of infections in animals. It is a rapidly growing aerobic mold with separate hyphae and highly colored colonies. The fungus produces small oval or spherical conidia that are borne from the tips of phyllodes. Aspergillus fumigatus can cause invasive infections, mycotoxic and allergic reactions. It is a opportunistic pathogen which infects through air, through inhalation or egestion. So first we will see what are the causes of aspergillosis. Aspergillosis is caused by a fungus called Aspergillus. The fungus is often found growing on dead leaves, stored grains, compost piles, or in other decaying vegetation. It can also be found in marijuana leaves, although most people are often exposed to Aspergillus infections caused by the fungus rarely occur in people who have a healthy immune system. Allergic bronchopulmonary aspergillosis is an allergic reaction. It is and the infection usually develops in people who already have lung problems such as asthma or cystic fibrosis. Aspergilloma is a growth fungus ball that develops an area of past lung disease or lung scarring such as tuberculosis or lung abscesses. Invasive pulmonary aspergillosis is a serious infection with pneumonia. This is a microscopic view of aspergillosis. Now we will see what are the symptoms and signs of Aspergillus. As you can see, there are organs that shows different symptoms, and it is called as the different disease for the different symptoms. So for example, for this purpose, if the symptoms are shortness of breath, fever, cough, chest pain, or coughing up blood, it is called invasive aspergillosis. If there is runny nose, headache, and reduced ability to smell, allergic aspergillosis sinusitis is here. And aspergillus mainly affects the kidney and lungs and brain. So the diseases are called allergic bronchopulmonary aspergillosis, chronic pulmonary aspergillosis, which mainly affect the fungus and forms a ball-like fungal in the lung cavity. Now, how aspergillosis infect and disease is progressed inside the body is seen here. First, inhalation of aspergillus fumigatus. It's the inhalation of spores that are present in the fungus, which goes inside the bronchial tree. Then tissue invasion, the mycelial growth may extend into blood vessel leading to vasculitis, thrombus formation and dissemination of other parts of the body. Then granuloma formation. Granuloma formation is the granules that yellowish gray nodules that are formed inside the body in attempt to contain the infection. Then fruiting head formation. As aspergillus is a fumigatus, it breaks out in the air space body and sex in chicken. It the chicken inhales it and distorted fruiting heads can be formed. So this is the list of all the symptoms that are shown by a body part, that is red eyes, plain blurred vision, and the type of aspergillosis disease that is caused when these symptoms are shown. If there is a sinus symptoms or stuffy nose, headache, then what type of disease is caused by the aspergillus fungus, as you can see from the table. Okay, so this is the bolus that is formed inside the lungs that is caused by the aspergillus fungus, and this is the skin symptom that is shown, that black patch is formed and is caused the aspergillus skin disease. Now these are the other symptoms that are shown, which causes the symptom of aspergillus and shows us on the ears. Diagnosis. Now we will see what are the diagnosis of the Aspergillus fungus. Diagnosis can be of many types, like the imaging test, that is chest X-ray and CT scan, that it is then biopsy, then skin prick test for mainly skin diseases, then galactoman test. This diagnosis of invasive aspergillosis may be facilitated by test of galactoman antigen detection in the blood using an enzyme immunoassay, then immunoglobulin E test, immunoglobulin G test. These are some of the laboratory diagnosis, that is specimen collection, microscopic examination, culture, then identification of the Aspergillus fumigatus, then the most important um, diagnosis is the septum test, which helps detect the presence of Aspergillus fungus in patients. The Aspergillus filament under a microscope. The substance is also placed in a suitable culture medium that promotes the growth of fungus. So it is stained by a dye. Now the treatment. How to treat Aspergillus disease. So on it can be treated orally by giving antifungal treatment or antifungal medicines like voriconazole, isavuconazole, and posaconazole, then liposomal amphotericin B, casofungin, then corticosteroids for aspergillosis are also given. To reduce inflammation, a provider might prescribe them to treat allergic formation of aspergillosis or skin infection. Then their orally it can be taken in inhaled, nasal, topical, or surgery can often cure aspergillosis caused by a single fungus ball. Proof treatment invasive allergic aspergillosis in certain circumstances provided recommended surgery to treat chronic pulmonary aspergillosis. Now prevention. How to prevent aspergillosis? Aspergillosis can be completely avoided in the environment and transmission by air in the commonest route but the risk of infection can be reduced. Avoid places where Aspergillus spores are abundant: forest, garden, compost heap, grain store, rotting vegetation, dead leaves, and building construction site or renovation area. The household environment and furniture surface should be kept clean, dust-free, and dry in order to minimize the accumulation of fungus and molds. Avoid skin injuries. Any open wound should be cleaned with antiseptic and covered with the clean dressing. In addition to this, good hygiene and a healthy lifestyle with help of immunity you immune your body defense against aspergillus and other infections. Certain food items like the spices and usually fond of aspergillus spores, so they should be avoided. Then World Aspergillosis Day is celebrated on February 1st. Thank you.